Hello, my name is Dawn Spelke, and I am a volunteer for Young Women in Bio in San Francisco. As part of our Young Women in Bio online series, I will be speaking about the epidemiology of COVID-19. Specifically, we will discuss key concepts in epidemiology, how these concepts explain the current spread of COVID-19, and how we can apply epidemiological tools to fight the pandemic. Understanding the epidemiology of COVID-19 will help you make sense of the news you've been hearing and why we're taking such drastic measures to stop it. Let's get started. In the first module, we learned about the biology of COVID-19, how it infects a person and makes them sick. In this module, we'll learn about the epidemiology of COVID-19, how it infects a population and spreads in a community. So first, what is epidemiology? Epidemiology is a branch of medicine that studies the health of populations, not just individuals. Epidemiologists are scientists who use tools and research from many disciplines, including statistics, microbiology, anthropology, geography, and public health to study disease and predict its behavior. A lot of what you're hearing in the news right now from experts such as Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, is epidemiology. How many people are infected? How many people have died? Where the disease is spreading? The expertise of epidemiologists will be critical in our ability to manage this dangerous pandemic. Since it was first identified in China at the end of 2019, COVID-19 has spread around the globe and has now been detected in almost every country in the world. As of April 8th, over 1.5 million cases and 85,000 deaths have been reported. When you're listening to this recording, these numbers will have grown. Every statistic you hear represents a snapshot in time. Statistics are also influenced by the accuracy of the data. Were all infections identified? Were all deaths reported? As we continue through this module, it's important to remember that statistics are only as good as the data, and collecting good epidemiological data across the world during a pandemic is not an easy task. The first question you may be asking about the pandemic is, why is COVID-19 spreading so fast globally? In just a couple of months, the virus has reached much of the world and dramatically changed all of our lives. The answer is exponential growth. Exponential growth means that the rate of infection is increasing. Today, more people will be infected than yesterday. The reason for this exponential growth is that each person infected with COVID-19 is infecting more than one other person. This results in very fast spread of the virus. How does exponential growth work? Let's walk through a non-virus example to make the concept of exponential growth more clear. Suppose on day 1 I give you 1 penny, and every day after your money doubles. So on day 2 you'll have 2 cents, on day 3 you'll have 4 cents, and on day 4 you'll have 8 cents. After just 1 month at this growth rate, you would have over $5 million. Think about that, from 1 penny to $5 million in a month just by doubling your money every day. If instead of a penny, let's assume one person was infected with COVID-19 at the beginning of the month. If COVID-19 growth followed the same pattern as the penny example, doubling every day, then in 1 month over 500 million people would have been infected. Luckily, COVID-19 is not doubling this fast, but you can see how exponential growth has led to the rapid spread of the virus. So COVID-19 is growing exponentially, but why? As mentioned before, exponential growth is the result of each infected person infecting more than one other person. In epidemiology, this concept is explained by the reproduction number, R0, written as a capital letter R with the subscript 0. R0 refers to the average number of people who will catch a disease from one infected person when no one has immunity or has been vaccinated. So R0 is a measure of contagiousness. If R0 is greater than 1, each person infects more than one other person, the infection rate is growing, and we will see exponential growth. If R0 is less than 1, each person infects less than one other person, the infection rate is slowing, and cases will go down. We want R0 to be less than 1. A number of factors influence the R0 for disease, including contact number, risk of infection, and infectious period. This illustration shows how these concepts influence R0 for a disease, not specifically COVID-19. The first factor is contact number, which is the number of people an infected individual comes into contact with each day. You can only infect people you interact with, so the more contacts an infected person has, the higher R0 will be. The second factor is the risk of infection. How likely is it that a contagious person will pass on their disease to one of the contacts? The probability of infection is dependent on characteristics of the disease and the population, such as the route of infection and the susceptibility of people to be infected. Finally, the infectious period is how long an infected person is contagious for. This is the time period where a contact can catch the disease. The R0 is a product of these three factors. Looking at this example, if the average person has 3 contacts a day, the risk of infection is 1 in 3, and the infectious period is 3 days, the R0 will be 3. On average, each person will infect 1 person a day, 3 contacts with a 1 in 3 chance of infection for 3 days, so the average number of people they will infect is 3. We can use R0 values to compare COVID-19 to other diseases. A common comparison you may have heard is to flu. Why is COVID-19 more contagious than the flu? Because of its R0 value. R0 for the seasonal flu is 1.3, while the current estimate for R0 for COVID-19 is 2.8. COVID-19 is more than twice as contagious as flu. There are also diseases that are more contagious than COVID-19, such as SARS, a similar virus with an R0 of 3.0, and measles, which has an R0 of 15. Measles is extremely contagious, but luckily we have a vaccine that mostly stops its spread. Let's review. What is the R0 in epidemiology? Did you get this answer? R0, the reproduction number, is the epidemiological measure of contagiousness. It refers to the average number of people who will catch a disease from one contagious person. Now that we've learned about exponential growth and R0, let's look at how COVID-19 infections have been growing worldwide. This graph shows the total number of COVID-19 confirmed cases and daily new confirmed cases from early February to early April. Let's first look at the total confirmed cases, the red line. The shape of this curve is typical for exponential growth. At the beginning of February, growth was slow, but the number of cases soon began to rise, and by the end of March, there were many, hundreds of thousands more cases. Exponential growth means that infections can get out of control quickly, causing a pandemic. Now let's look at the daily new confirmed cases, the yellow line. This curve is also increasing. Each day, more people are infected than the previous day. In other words, the R0 is greater than 1. This increase in daily cases is what is leading to the exponential growth of total cases. Looking at these graphs, note that both curves have the word confirmed in their names. The data here is confirmed total cases and confirmed daily new cases. This clarification is important because it lets you know that the data is only what has been reported. Some, maybe a lot of cases, may not have been included. Why? One reason is testing. Cases can only be confirmed if testing is available and widespread. You may have heard that COVID-19 testing has been limited and sometimes unavailable, so there are certainly cases that were missed. Another reason is compiling case reports from all over the world is hard, and there can be lags in reporting data, so data may not be up to date. It's important to always think about what data went into a graph and how the quality of the data may impact conclusions. Epidemiological analysis, like all scientific analysis, is only as good as the data. Growth of COVID-19 in the United States has followed a similar trend as COVID-19 growth worldwide. From late January to early April, cases in the United States grew from fewer than 10 to over 300,000. Looking at a few snapshots of the data, you can see that on March 10th, there were about 750 cases. On March 20th, 14,000 cases. On April 1st, nearly 200,000 cases. And as of April 8th, there are nearly 400,000 cases. COVID-19 is growing exponentially in the United States. The growth curves worldwide and in the United States look similar, which makes sense since it's the same disease infecting the same target, people. Once we know how a disease behaves in one population, people in China, for example, epidemiologists can predict how it will behave in a similar population, such as people in the United States. The data and analysis gathered from initial outbreaks can be used to fight a pandemic as it spreads. If exponential growth occurred in China, exponential growth was likely to occur in the United States if COVID-19 got in and started to spread, which it did. Knowing that exponential growth is likely can help communities implement measures early when cases are still low. So far, we have discussed how infectious COVID-19 is and why it's spreading so fast. The other big question you may have is how deadly is COVID-19? What is the likelihood of dying from COVID-19 if you are infected? While this seems like a simple question, the answer is complicated by the accuracy of the data available, similar to our previous discussion on the number of cases. So, we really don't know yet how deadly COVID-19 is. The death rate being reported in the news is the case fatality rate, or CFR. The case fatality rate is the number of reported deaths divided by the number of reported cases. Note the word reported. The case fatality rate is critically dependent on how many cases and deaths are diagnosed. If testing is limited, so the number of reported cases is lower than the true number of cases, the denominator will be smaller and the case fatality rate will be higher. We would overestimate the deadliness of COVID-19. On the other hand, if deaths from COVID-19 are not reported, for instance because some people are dying in their homes outside of the healthcare system, the numerator will be smaller and the case fatality rate will be lower. We would underestimate the deadliness of COVID-19. The infection fatality rate, or IFR, is closer to the true mortality of a disease. The infection fatality rate is the true number of deaths divided by the true number of cases. It is independent of missed data due to failures in testing or reporting. Since we can never be sure that every case is identified, the infection fatality rate cannot be measured. The goal instead is to have the case fatality rate be as close as possible to the infection fatality rate. To make these definitions more clear, let's look at this example for a hypothetical disease. Here, 30 people were infected. 10 of those infections were detected, and one detected infection was fatal. The case fatality rate in this example is 10%, one reported death out of 10 reported cases. The infection fatality rate, however, is 3.3%, one death out of 30 cases. This difference highlights the impact of accurate data on the reported fatality rates. We can use the case fatality rate to compare the deadliness of different diseases. For example, Ebola, which is incredibly deadly, has a case fatality rate of 50%. The seasonal flu is much less deadly, with a case fatality rate of 0.1%. One question that has frequently been asked is COVID-19 deadlier than the flu? The answer is yes. The case fatality rate for COVID-19 is 10 to 30 times higher than seasonal flu. Why are there two case fatality rates reported in this figure for COVID-19? As we just discussed, because the case fatality rate is dependent on testing. So far, COVID-19 testing has been slow in the United States, so we are likely underestimating the true number of infected people. The case fatality rate so far, of 3.4%, is likely higher than the true fatality rate. Once we have more widespread testing, the number of reported cases is expected to increase, and so the case fatality rate is estimated to be lower at about 1%. 1%, however, is still high. 1 in 100 infected people will die, which, in combination with the high infection rate and exponential growth, makes the COVID-19 pandemic very dangerous. So, what tools do we have to fight the COVID-19 pandemic? Since the virus is novel, we don't yet have treatments or a vaccine. The main tool we do have is epidemiology. Understanding and being able to predict how COVID-19 will spread and impact communities allows us to implement measures to fight it. You're probably already experiencing disruptions to your daily lives in an attempt to fight the COVID-19 pandemic. You might be wondering, why is everything being canceled? Why am I staying home from school? The answer is we need to flatten the curve. Flattening the curve is an attempt to slow the spread of COVID-19 and lower the peak number of infections. From everything we've learned so far, we know that COVID-19 will spread exponentially and lead to many deaths. The shape of the curve, however, is partly under our control. Looking at this figure, the orange curve is a representation of how COVID-19 will spread in a community without interventions. The slope of the curve is very steep, meaning that a lot of new infections are occurring every day. There is fast exponential growth. As a result, the peak or top of the curve is high. At the worst part of the pandemic, a lot of infections will be happening at once. However, if we implement measures to slow the spread of COVID-19, we could experience the blue curve instead. The blue curve is flattened compared to the orange curve. The slope of the curve is less steep as the spread is slower. Flattening the curve has two main results. First, the peak of the curve is lower. At the worst part of the pandemic, less people will be infected at once. Second, the peak in overall infections will be delayed. The result of this flattening is that the pandemic may last longer, but it will be less severe at the peak. Let's think now about why we need to flatten the curve. The same number of people may be infected during the COVID-19 pandemic, even if we do flatten the curve. So why is this scenario better than the one without interventions? First, if we can contain the spread of the virus, we can lower the number of people who get sick at the same time. Having less people sick at once will help essential businesses stay operational. Grocery stores will be stocked and you'll keep getting mail. Second, reducing the peak of illnesses will lessen the burden on our healthcare system. Our hospitals are not equipped to handle the expected surge in COVID-19 patients. Hospitals could run out of personal protective equipment such as masks, gloves, and gowns, and they may not have enough hospital beds and ventilators for everyone who needs them. We also need healthy doctors, nurses, and hospital staff to treat the COVID-19 patients. If these critical workers are sick as well, the healthcare system will be even more strained. Spreading out the cases over a longer period of time and reducing the peak will allow our hospitals to gather additional resources and be able to treat more patients. Finally, flattening the curve gives us time to research the virus and develop treatments and vaccines. If a successful therapy or vaccine is developed during the flattened curve, we may be able to stop further spread and reduce the deadliness of the disease. For more information on how we can flatten the curve, please watch the module on social distancing. Let's review. What does flattening the curve refer to? Why is it important? Did you get this answer? Flattening the curve refers to reducing the peak of infections to lessen the burden on our healthcare system. Flattening the curve is important as it will give us time to properly care for patients, research the virus, and develop treatments and vaccines. The last topic we'll discuss is testing. Why do we need more testing? As we've learned, epidemiological analysis is only as good as the data. The data relevant to understanding and combating the COVID-19 pandemic is how many people are infected. Knowing if someone is infected requires testing. So, widespread and easily accessible testing will improve the accuracy of our data, enabling us to better understand the epidemiology of COVID-19. For example, the case fatality rate, the measure of the deadliness of a disease, will approach the true mortality rate as a higher percentage of cases are identified. Increased testing will also tell us how many infected people are asymptomatic and may be unknowingly contacting and infecting others. Knowing the rate of asymptomatic infections will help us implement effective countermeasures. Finally, testing will tell us where infections are spreading, so it buys us time. If we can identify an outbreak before it can rapidly grow, we can target interventions in those communities and send resources to hospitals before they are overwhelmed. Testing is also needed for long-term monitoring of the COVID-19 pandemic and to assess the effectiveness of interventions. COVID-19 will likely be around for a long time. It may even become a commonly circulating virus like the flu. Continued testing will allow epidemiologists to track COVID-19 over time and around the world. We will be able to see if interventions, such as the social distancing, have been successful. Have we flattened the curve? We will only know if the infection rate is slowing with widespread testing. Have infections dropped enough so that we can ease interventions, such as social distancing? Again, we will only know with widespread testing. And if continued testing shows that the infection rate is creeping back up after interventions are lifted, we can act early to prevent a resurgence of COVID-19. Testing is our window into the COVID-19 pandemic. Let's summarize what we've learned about epidemiology and what epidemiology tells us about the COVID-19 pandemic. First, Naught, the reproduction number, is a measure of contagiousness used by epidemiologists. It is the average number of people who will catch a disease from one contagious person. If Naught is greater than 1, the infection rate is growing. If Naught is less than 1, the infection rate is slowing. Second, the case fatality rate is the number of reported deaths divided by the number of reported cases. If testing is limited, the case fatality rate will be higher. If deaths from COVID-19 are not reported, the case fatality rate will be lower. Finally, flattening the curve is a major goal. Reducing the peak number of infections means less burden on our healthcare system. Observe these three measures as you follow the progress of the COVID-19 pandemic. Thank you for joining us, and stay safe, everyone. We are all in this together. Look for more virtual events and important information at YWIB online.